Have you been neglecting the skin on your neck? If crepey neck skin is a concern for you, stick around because I am sharing tips and treatments to keep that skin looking smooth and firm. If you are new here, welcome. I am Dr. Eric Berg, and I am here to help you understand your skin and find products and treatments that truly work for you. So if that sounds good, make sure to subscribe to the channel and give this video a thumbs up. Before we delve into the skincare products, lifestyle modifications, and in-office treatments you can use to improve the skin on your neck, I always want to be crystal clear. This is a completely personal choice. Aging is a normal thing that happens and you do not have to fight it. But if you are noticing that your neck is bothering you and you want to do something about it, I think it is important to hear and learn about what to do from a reputable source. I really created this channel to give accurate, honest information about skin, hair, and nails, and I never want anyone to feel self-conscious while watching a video. It is truly just so you know what your options are if you decide to explore them. That classic crepey texture with all the tiny fine lines and wrinkles that we see on our neck and on other parts of our body as we age is really due to a loss of skin integrity. What I mean by that is that we are losing the support structures in our skin, or they are getting degraded as time goes on. For example, collagen, which provides our primary structural support, is something we produce less of and break down more of as we get older. The same goes for elastin. Elastin is what makes our skin stretchy and able to bounce back, but as we age, elastin depletes, so our skin loses that snapback quality. Our skin also tends to produce less oil and becomes more dehydrated as we age. When the skin lacks oil and water, it emphasizes the appearance of fine lines and wrinkles. One thing that is particularly frustrating about our neck skin is that it tends to show aging changes faster because it is thinner than the skin on our face and 5 times stretchier. It is much more elastic, and as that elasticity drops with age, we are left with a lot of loose or sagging skin. We also have to keep in mind that aging on the neck is only partly due to skin changes. We must consider what is happening to the structures beneath the skin, like fat and muscle. The integrity of all those underlying structures can shift and change as we get older. When you combine issues in the skin, muscle, and fat, that is when people start becoming very dissatisfied with their neck's appearance. However, earlier on in the aging process, all we see are changes in the skin itself, and that is what this video is focusing on. What you can do at the superficial top layers of your skin to improve the appearance of your neck. I am going to start off talking about things you can do at home in your skincare routine and lifestyle to improve your neck skin, and then we will talk about in-office treatments. The reason I think it is important to address both is that whenever I am at a conference lecturing or listening to lectures on neck rejuvenation, literally the phrase that comes out of everyone's mouth is that the neck needs the kitchen sink. You need to come at the neck from every single anti-aging angle to see improvements because it is so dang stubborn. Because of those unique properties, being in a highly mobile area, being thinner, and being stretchier, it is simply less responsive to things like lasers, topical skincare, or even surgical interventions. So when you are thinking about improving the appearance of the neck, the more things you can do to push it toward rejuvenation, the better. One of the best things you can do for your neck skin and how it ages is to maintain a stable body weight as much as possible. Because neck skin is so stretchy, when you gain weight, lose it, gain it, and lose it again, that skin stretches and contracts repeatedly. Eventually, it reaches a point where it stretches and does not snap back. Sometimes this weight fluctuation is inevitable, like during pregnancy, stressful life periods, or when taking certain medications, but if you can optimize your weight and keep it as steady as possible, the reality is that it will help your neck. Sometimes I get asked about neck exercises and whether they will help improve the appearance of the neck. No, they will not. Honestly, the more you strengthen your neck, the worse it can actually look. We have structures called platysmal bands, which are thick ropes of muscle running down from the jawline toward the collarbones. If you strain or exercise your neck, it can actually make those platysmal bands look much worse and age the neck more rapidly. I see this all the time in very thin individuals who do activities like Pilates or weight training that heavily engage the neck muscles. Their necks tend to look a bit more aged. I am not telling you to stop exercising or avoid those activities. They are far more important than the cosmetic appearance of your neck. It is just something to be mindful of. When it comes to lifestyle, the single most important factor for neck rejuvenation and maintaining skin health is sun protection. It sounds obvious, but I see people every single day in my practice whose faces look amazing, with no sun damage, and then I look at their neck and chest and it is 4 shades darker. Most of us did not grow up being taught to apply sunscreen, so it can feel like a big adjustment to start putting it on your face, let alone extending it down to your neck and chest. But protecting those areas is paramount. UV radiation breaks down collagen and elastin. Even if you are doing every other anti-aging neck treatment available, whether surgical or in-office, if you are not protecting that investment with sun protection, your results will be limited and short-lived. There is actually a specific skin condition called poikiloderma of Chivate, which refers to distinct aging changes on the neck and chest caused by sun damage. I see it all the time, and it presents as a reddish-brown discoloration. It often spares the area directly under the chin because the chin acts like a little baseball cap, protecting that section your whole life. Along with that splotchy red-brown appearance, you also get a chicken skin-like texture. That texture is actually your oil glands poking through because the surrounding skin has thinned out so much that you see all this pebbling underneath. The more sun exposure you have had in your lifetime, the more likely you are to develop it. But fear not, because there are certainly things we can do in office to help reverse it. Aside from bringing your sunscreen down onto your neck and reapplying it frequently, which you should always do because clothing and movement can rub it off, I also recommend using physical sun protective clothing on your neck, especially if you do regular outdoor activities. Many of my patients play tennis, golf, or hike, and if you wear a neck gaiter or bandana to shield that skin, you do not even have to worry about constantly reapplying sunscreen there. Luckily, there are many great companies making sun protective clothing now, like Solbari and Coolabar. I will link a few of my favorite neck protection items in the description box below. This is something I recommend keeping in your car, tennis bag, or golf bag so you are never caught outside without it. Because sun protection awareness is growing, it is much less of a fashion taboo to wear protective clothing. When I am out taking a walk, I see people wearing wide-brimmed hats and bandanas, and it is so great to see. Now, assuming you are protecting your neck, what can you actually do to reverse some of the existing damage and negative changes? Similar to eye creams, my perspective is that you do not necessarily need a dedicated neck cream. You can simply take whatever products you are using on your face and bring them down to your neck. The one detail to keep in mind is that neck skin is much more sensitive, irritates more easily, and develops rashes faster. If your neck cannot tolerate a product you use on your face, that is the point where you should choose a milder alternative or dedicated product for that area. When looking at ingredients that benefit neck skin, they are the same ones that benefit the rest of your body. Retinoids for collagen stimulation and cell turnover, alpha-hydroxy acid exfoliants like glycolic and lactic acids to draw water to the skin's surface, boost turnover, and thicken the skin, and hydrating moisturizers to improve the barrier function. If you prefer using a dedicated neck cream, that is completely fine. They are not bad products at all. But if your skin tolerates your facial products, they serve the exact same purpose. The main psychological benefit of having a dedicated neck product is that it forces you to focus on the area. In skincare, the neck is so often an afterthought where you apply everything to your face and then quickly swipe whatever is left onto your neck. Having a product specifically for your neck ensures you are more deliberate, apply it consistently, and ultimately see better results. For example, a popular option is the elastin restorative neck complex. Elastin is well known for their proprietary peptide that helps stimulate elastin. Elastin is notoriously difficult to stimulate in the skin compared to collagen, but since the neck is naturally stretchier, targeted peptides that support elastin integrity can be very helpful. Another great option is the Allies of Skin Retinol and Peptides complex. A lot of people use prescription-strength tretinoin on their face for anti-aging, but it immediately causes irritation when applied to the neck. For anyone with that issue, a product like Allies of Skin works well because it combines anti-aging peptides with retinaldehyde, a form of retinoid that is effective yet much less irritating than prescription tretinoin. I also fully recommend bringing your facial exfoliating acids down to your neck. While facial exfoliation is often used to address dullness, it also stimulates collagen. On the neck, where dullness is less of a concern, we rely on those acids primarily for collagen production. For instance, when using an exfoliant like the Prequel multi-acid milk peel, which contains 15% glycolic acid along with other AHAs, it can be applied to the face first, and then whatever remains on the hands or cotton pad can be swept over the neck. Whenever you apply potentially irritating active ingredients to the neck, always follow up with a rich moisturizer to soothe the skin and protect the barrier. Another topical option that can significantly aid neck skin is topical estrogen. This is not an over-the-counter item. It must be prescribed by a physician or dermatologist. If you have estrogen-deficient skin, meaning you are approaching, currently in, or post-menopause, topical estrogen can restore suppleness and hydration. During menopause, tissue levels of estrogen drop because estrogen plays a vital role in skin plumpness, moisture retention, and oil production. Losing it becomes immediately noticeable in thinner skin areas like under the eyes and on the neck. That is why so many people feel like their neck changed almost overnight during menopause. Replacing that deficient estrogen locally with a topical cream can noticeably improve the skin's appearance. For another at-home option, consider incorporating red light therapy to support neck skin integrity. Red light is one of the few at-home skincare technologies that is genuinely effective. It helps stimulate collagen production and reduces inflammation, which can be particularly soothing if your neck is prone to irritation. Using red light a few times a week can noticeably improve crepey texture. If you want more details, I have a full video dedicated to red light therapy that you can check out. If you already own a red light face mask, you can simply run a second session with the mask resting over your neck, or you can purchase devices specifically shaped for the neck and décolletage. Remember, to achieve the best possible outcome, you need to address the neck from multiple angles. Doing in-office procedures does not mean you should ignore your at-home routine, and maintaining a great at-home routine does not mean in-office treatments cannot offer additional benefits. In an office setting, the main goal for neck skin is to stimulate new collagen and elastin. This is generally accomplished in one of two ways: injecting a biostimulatory product into the skin, or creating controlled microtrauma so the skin repairs itself stronger. There are several ways to induce that controlled trauma, such as traditional microneedling, radiofrequency microneedling, laser resurfacing, chemical peels, ultherapy, or thermage. Essentially, we are applying heat trauma, mechanical trauma, or a combination of both. In practice, standard microneedling is one of the most popular methods for resurfacing the neck because it offers a great balance between affordability and minimal downtime. However, when working on the neck, treatment settings and intensity cannot be turned up as high as they are on the face because the skin is so delicate. As a result, the neck typically requires more sessions to achieve the desired outcome. For microneedling, that often means a series of 4 to 6 sessions spaced 1 to 2 months apart, followed by ongoing maintenance, such as 1 or 2 sessions a year, since the aging process continues naturally. For those open to a bit more downtime and financial investment for more dramatic results per session, a heat-based treatment like Fraxel laser resurfacing can effectively remodel the skin. It is somewhat rare for patients to treat only their neck. Most choose to treat their face and add the neck as an extension of the same session. A few other effective in-office options include microbotox and biostimulatory injectables. Microbotox involves placing tiny, superficial droplets of neurotoxin into the upper layers of the skin. It is not used to freeze muscle movement, but rather because shallow placement helps refine skin texture. While the improvement is subtle, it serves as a great enhancement for someone combining multiple approaches. To rebuild structure, biostimulatory injectables like Sculptra or Radiesse can be used to trigger collagen and elastin production. These are technical fillers, but the goal here is not to add localized volume. It is to act as a fertilizer for your cells, signaling them to produce fresh structural proteins. Combining treatments often yields the best outcomes. A common protocol is administering hyperdilute Radiesse, where the product is thinned down with saline to create a smooth wash, and injecting it across the front of the neck to stimulate long-term collagen and elastin. During that same visit, the area can be treated with microneedling or Fraxel resurfacing to target the neck at different depths simultaneously. If you are still watching, this next point is crucial. Every single product and procedure discussed so far will not fix a sagging or waddly turkey neck. If you have significant loose skin hanging under the chin, non-invasive skin treatments will not resolve it. When skin laxity reaches that stage, the only way to truly restore the area is through a lower face or neck lift to surgically pull the skin back. While that may not be what everyone wants to hear, it is important information. Investing time and resources into topical or energy-based treatments with the expectation that they will eliminate severe sagging will only lead to disappointment. In cosmetic consultations where significant laxity is the main concern, referring the patient to a plastic surgeon is often the most honest and effective path forward. If you have any personal tips for neck rejuvenation or have tried a product or procedure you love, Please share your experience in the comments below. I love reading them, and I know other viewers do too. Don't forget to subscribe to the channel and give this video a like. I will see you next time.